Well, if you were asked what the oldest medical specialty in the U.S. was, what would be your guess? I'm willing to bet most of us, myself included, I tried to guess, would get this one wrong. I will tell you it has something to do with the ear, nose, and throat, and I'm going to turn the full explanation over to my next guest. We have Rob Montagni's back with us. He's the CEO of Licking Memorial Health Systems, and he is joined today by Dr. Bradley Lawson. So, gentlemen, thank you for being here.
Good morning. Good to be here.
All right, I've been practicing how to say this, so Rob, I'm going to ask you for what is otolaryngology? Did I say that well?
You said it perfectly.
Perfectly. Okay, I like
ENT is the best explanation. You got it right in your introduction, ear, nose, and throat. And certainly those of us who have children, if you've had any issues with chronic ear issues, certainly tonsils, things of that nature, Dr. Lawson, Dr. Parker, his partner, can take care of the whole spectrum of issues. And I think probably compared to most of our practices, they see patients from the very, very young to geriatric patients and do a tremendous job with any of their issues with the ear, nose, and throat.
And I feel like this is something almost everyone can be impacted by. I feel like we've all had, sinus issues or things that come up. And so having a good ENT team and knowing where to go is highly important. So Dr. Lawson, let's talk then about that. Some of the common ailments that you see. And, he mentioned chronic ear infections in kids. I mean, that kind of happens a lot.
Yeah, extremely common. So we see a large portion of children in our practice. So we do see children with frequent ear infections or chronic fluid behind the ears causing hearing loss. And one of the most common procedures that Dr. Parker and I perform is placement of ear tubes for those children.
Yeah, my son had him when he was just over a year old, and you get nervous as a parent, but it is a very simple procedure. I learned afterwards to not be nervous about, right?
Yes, absolutely. Very quick and straightforward. Generally speaking, we're in and out of the operating room in 10 to 15 minutes with those children.
So, and at Licking Memorial, I mean, you guys still you focus on preventive medicine as well, right? So when it comes to these issues, are there ways that you can find someone early and maybe not have them deal with these problems later?
Well, in general with our children, kids who are in daycare or shared facilities are going to have more infections in childhood. And in some instances, that's just a normal part of daily life for those kids. So there's not a whole lot to do as far as prevention with those children, but early identification, our pediatricians do an outstanding job getting them in a hearing test at an appropriate time and then getting them on to the specialist when needed is what we do.
Right, you want to send them off to school being prepared to learn and that kind of stuff, so finding it early. And do you provide care then beyond just the ear, nose, and throat? Is there any other area that you focus on? Right,
absolutely. So, our specialty also includes head and neck surgery. Both Dr. Parker and I do thyroid and parathyroid surgery, whether that is for enlarged thyroid glands, nodules, even thyroid cancers. We also take care of salivary gland tumors and many head and neck cancers as well fall into our scope of practice.
So it really does run the gamut on age, right? I mean, there is no too young, too old.
Absolutely. We see newborn babies sometimes in the nursery to perform procedures as far as tongue tie that prevents latching for breastfeeding. All the way to, I saw a 94-year-old World War II veteran 2 days ago in my office. So we go from cradle to geriatric for sure.
Okay. All right. So Rob, any information you can share, concerning Licking Memorial ENT and kind of what you guys can offer for folks?
Well, I think we're really proud. Both Dr. Parker, Dr. Lawson are tremendous. The only thing I would encourage folks is certainly try and leverage your relationship with your primary care or your pediatric physician. It's not that we don't want folks going right to the specialist, but oftentimes issues can be resolved with your primary care physician, and that allows them to get folks in a little more quickly. So maybe check on a referral or at least with your primary care. And then if you need that assistance, we can get you to one of the experts and they will take good care of you.
As always, we expect nothing less from Licking Memorial. So there you go, all the information on the screen for you today. Dr. Lawson, Rob, as always, thanks for being here.
Thank you.
Thanks for having us.